What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video we're covering Xray Tech School expectation for clinicals versus what you actually do on the job. So, to give you context, I am a night shift Xray Tech, been doing it for 4 years. I also dabble in the day shift, work a lot of overtime. So I would say as far as like the school expectations, they make you feel like if you clip something, it's the end of the world, or if you have to expose the patient more, it's the end of the world. Like, the only time that it is if you shoot the wrong patient and they didn't need one, then you're in trouble on that one. But that far, and then as far as like your uniform, that has to be pristine. It has to be. Sometimes, as long as you just show up and you're in the right color, your shoes don't have to be close to it. Like, I mean, they would be preferred if they are because of bodily fluid and stuff, but you don't have to be perfect as far as that. Like, this is very important. Like your badge, there's sometimes people forget their badge is a little bit different, but this one is important because of the dosage of the radiation if you hold and stuff like that. I would say that when you're in school, you're like so. That part of you is kind of afraid of the radiation and stuff like that. And then once you're on the job, you're just like, all right, come on, let's just let up. And then you shoot. And then you just try to, get the job done type stuff. Even same thing with radiation safety. I've noticed, I ain't saying it's good, but you slowly see techs, especially the veteran techs, quit caring about the radiation, some of the safety, which I don't think anyone should because it is dangerous. But some of the techs you'll see with time to time are doing risky plays or thyroid and stuff like that. And some of them will kind of be like, it's just whatever, because, with most of the stuff, it's not that it'll get you right away. It's like kind of a long-term, just tiny doses a day that will get you. Same thing with like all the documentation. They make you seem like you have to and it's like basically you copy and it's just like chest pain. This, that. One thing I would say that's a little bit different is, and I learned this on the job, and I did learn, sometimes they'll order stuff and the doctor will word it in a certain way that maybe the patient isn't exactly feeling in that sense, but for insurance to cover it, they have to word it in a certain way so they'll cover it, which I didn't even know that. That's something that's weird. You would assume you have insurance, you need a chest x-ray, they'll cover it. But apparently certain stuff make it seem like it's a miscellaneous x-ray, like you didn't need it, you just wanted it type of deal, so it's kind of weird. That's something that I did not expect, but that's something that was different from clinicals and stuff like that. And then the level of professionalism amongst your own peers will kind of vary. Which, same professionalism with the patient is always kind of the same. You're trying to give the best knowledge. But amongst your coworker, your peers, the students, you can see how more of them are like uptight and kind of strict and kind of, versus like once you're on the job, you're just more chill, more relaxed. And then like the workflow and even the collimation and stuff. Because sometimes some of the students will like collimate it really, really tight and then clip it. And you're like, yo, you could have left it open and kind of reduced the dose by not having to shoot it twice. So there's stuff like that. Yeah, it's been your boy Miguel. See you on the next one.